Assalamualaikum and hi everyone. Our group of 5 will present about radium-223 radionuclide and its application in medical therapeutics. Radium-223 dichloride, or known as Zofigo, or being called as alpha-radin, is an alpha-emitting radiopharmaceuticals containing radium-223 radionuclide emits short-range tissue penetration about less than 1 mm but high linear energy alpha particles which targeted uptake in area osteoblastic metastasis lesion. Radium-223 is a calcium mimetic that, like calcium, accumulates preferentially in areas of bone that are undergoing increased turnover, such as areas where bone metastases are forming. When the cancer cells receive high energy of alpha particles, it will be killed. And these alpha emitter radionuclides improve in the treatment of patients who have metastasis bone cancer that is symptomatic with no visceral metastasis, and also in castration-resistant prostate cancer (CRPC) treatment. First and foremost, the radium is the elemental chemical in alkaline earth metal family on periodic table as shown in this slide, and it will localize to the area of osteoblastic metastasis. In the periodic table, radium was symbolized by Ra with atomic number of 88 and atomic mass of 226. It is in solid state at 20 degrees Celsius and strongly basic characteristic. For your information, the radium-226 was discovered by Pierre and Marie Curie in 1898, which has half-life of 1,590 years. Radium-226 is the most common naturally occurring isotope of radium. However, radium-223 is the most useful for medical therapeutics due to its half-life of only 11.4 days. Although it presents naturally in small amount, radium-223 is manufactured for medical purpose by neutron bombardment of radium-226. In this table below, it summarizes the details of radium-223 decaying to the stable isotope, which is lead-207 after emitting of 4 alpha particles. There are some disadvantages of radium-223, which it has high potential to cause fatal harm, and advice should not be used in women who are pregnant or may become pregnant. Other side effects of radium-223 include low blood cell counts, peripheral edema, nausea, vomiting, and diarrhea. However, radium-223 radionuclide could shrink in the areas of cancer cells that have spread to the bone. This results in reducing pain symptoms in 58% of patients and also helps the patient feel more comfortable. This result is proved by Italian study 2015, which radium-223 was shown to be an effective and well-tolerated therapeutic option in patients with metastatic CRPC.
Assalamualaikum warahmatullahi wabarakatuh. My name is Nurul Hidayah. I will continue about radium-223 and metastatic prostate cancer. Bone metastases are one of complications of prostate cancer. It occurs when cancer cells break away from the original tumor and spread to the bones. Bone metastasis can cause intense pain, weakness, and bone fractures, and in some cases causing death. Radium-223 dichloride treatment can help to minimize any further spreading of cancer and relieve pain because there is no cure for bone metastasis. Radium-223 is a calcium mimetic. It will accumulate in the area of bones that are undergoing increased turnover as seen in bone metastasis. The alpha particle radiation emitted will cause double-strand breaks in DNA. This will lead to cell death and prevention of the spread of the bone cancer cell. Next, I will continue about procedure and protocol. Pre-treatment, patients should have a medical consultation with the nuclear medicine physician before starting this treatment. It is to check the indication on contraindication based on clinical, biological, and bone scan data of the patient. The physician will explain to the patient the expected radium-223 dichloride benefits and also the potential side effects of it. The total body scan or sodium fluoride PET-CT scan may be conducted to assess patient's eligibility for treatment, and bone mineral density measurement in order to investigate osteoporosis. Patient will also be asked to have these following blood tests: PSA, complete blood count, and alkaline phosphates. These tests will be done 2 weeks before the treatment and each treatment cycle. Radium-223 trichloride is usually given once every 4 weeks for a total of 6 injections. Radium-223 dichloride will be administered only by authorized persons. The procedure will be conducted in an outpatient setting. Post-treatment, the net patient dose of administered radium-223 dichloride will be measured by an appropriate radioisotope dose calibrator to ensure that radiation dose exposure to carers or household member is low. The carers looking after the patient will be asked to follow a few precautions of radiation protection safety.
I'm Zulfa. I will proceed with patient dose and dose administration. For patient dose, the dose of radium-223 dichloride, which known as Xofigo, recommended is 55 kilobecquerel per kilogram body weight. This is stated by Boyton in 2003. There is no need to adjust your dose if you are 65 years old or older, or if you have impaired kidney or liver function. For dose treatment delivery or administration, there are 3 steps. First, initial consultation. It is recommended that patients receive appointment for all 6 injections at treatment initiation. However, enough flexibility is needed for patients to reschedule appointment if they are unable to attend on a particular date. It is important that patients receive detailed information about radium-223 from a well-known source. Second, blood test. It is recommended that patients receive reminder of their blood test appointments to streamline care. For patient convenience, the first blood test can be carried out on the same day as the initial consultation. This ensures that the blood test results are available quickly, so the first injection can be scheduled shortly afterwards. Third, administration of radium-223. This is particularly important in centers where nuclear medicine physicians do not perform the radium-223 administration. When physicians, 2 staff members, which is not necessary 2 doctors, should be present at each injection to ensure that the radioactive material is handled correctly. Radium-223 is administered by a 3-way tap with lower lock connectors and an IV line. Allowing relatives to attend the injection process is an option where regulations allow and the patient consents. Xofigo will be slowly injected into one of your veins via a needle intravenously. Before and after injection, the healthcare professional will flush the intravenous access line or cannula with saline solution. The volume to be administered to a given patient should be calculated using first, patient body weight in kilogram. Second, dosage level, which is 55 kilobecquerel. Third, radioactivity concentration of the product, which is 1100 kilobecquerel per ml at reference date. The reference date is stated on the vial and lid pot label. Fourth, decay correction, which known as decay factor, to correct for physical decay of radium-223. A table of decay factor is provided with each vial as part of the booklet. The amount of radioactivity in the dispensed volume shall be confirmed by measurement in a properly calibrated activimeter. The total volume to be administered to a patient is calculated as follows. Volume to be administered in ml is equivalent with body weight in kilogram times activity, which is 55 kilobecquerel per kilogram body weight, divided by decay factor, which is times 1100 kilobecquerel per mil.
Is radiation monitoring and safety. In general, all types of radionuclide or radiopharmaceutical must be handled by a qualified personnel or radiopharmacist, same as a radium-223. So before dispensing the radionuclide, always monitor for the background radiation or contamination. So background radiation monitoring is to ensure that no additional activity will be administered to the patient, so that reducing the exposure to patient. The personnel should be wearing ring dose dosimeter to monitor their finger dose, as they are exposing their finger or hand when handling the radium-223. When radium-223 is not in use, it should be kept at a secure container or secure place to prevent unnecessary exposure or to prevent loss of this radionuclide. So other than that, the activity and volume administered to patient must be verified by authorized nuclear pharmacists to ensure that the activity is enough to treat the cancer and sparing the surrounding healthy tissue based on the patient weight. So the safe use of radium-223 or any other radionuclide is based on the ALARA principle, which is the as low as reasonably achievable principle. Always keep the distance, reduce the time, and use shielding when handling radium-223. So lastly, all the records of radium-223, such as patient dose, dispense record, background labels, any damage, leakage, failure or malfunction, and the radioactive waste must be kept. All the records should be accessible for retrieval. Next is the radiation safety. Radiation safety can be categorized to three groups or three categories. So which is the personnel, patient itself, and the carers or caregiver. So personnel must be wearing a ring dosimeter to monitor their finger dose, as mentioned earlier. Next is to protect or reduce the exposure. The urine must be shielded when dispensing or administered radium-223 to patient. However, as we know that radium-223 emit alpha radiation, which is a short-range radiation, it can be stopped by a piece of a paper, so that the syringe wall itself is enough to shield the radiation from penetrating. So then the personnel should ensure that no contamination on the working areas. So the working areas should be not contaminated with any radioactive material. If the radium-223 is in a liquid form, it must be carried in a trays having absorbent tissue paper, so that any spillage will get absorbed by the paper. And personnel must always use the rubber glove when working with the radioactive material. For patient safety, activity administered is lower than the standard level, just enough to treat the prostate cancer and sparing the healthy surrounding tissue. Patients should be remain under clinical observation, basically for 4 to 8 hours after injection, for scanning, blood collection, radiation safety service, or any early adverse event evaluation. Other than that, the radiation safety staff or any personnel must provide the patient with a verbal or written instruction describe the simple step to be followed at home prior to patient release, in connection basically related to the blood of the patient, urine or stools for a period of 1 week after dosing, and the patient itself should have a good personal hygiene. As we know that after the treatment, some radiation may be present in the patient urine or their stools for 1 week or more. However, the amount is extremely small and get lower each day. Hence, what patient need to do is they should drink plenty of fluids or water for a few days. When they are going to toilet, they should sit down on the toilet when passing urine instead of standing up, so that their urines will not be spread anywhere in the toilet. Or another option is they can use a urinal, using a urinal for a first few days. Then patients should always use a wash after every time they use the toilet. They should wash their hand and should flush the toilet twice after using it to ensure that all the urine is flushed through the toilet, and their clothes, it must be washed separately to their household member when it becomes soiled with urine or feces. Then lastly is a carer. So carers or a caregiver is a person who voluntarily, willingly, must be more than 18 years old, not pregnant, and knowingly assist or help in the care, support, and comfort of patient undergoing a therapeutic medical radiation procedure. It must be ensured that the dose received by a member of public or carers are below than the dose estimated per annum or per year, such as millisieverts to a member of public or below 5 millisieverts to carers. For radium-223 that emits the alpha radiation, which is not penetrating, so only few precautions are necessary to protect the household members from radium-223, and the radiation dose around individuals administered are low and not penetrating through the body. So household member and carers just need to keep their distance to the patient, do not share any utensil or toilet, and always keep children or pregnant women from the patient until the radiation level is considered safe.
Assalamualaikum warahmatullahi wabarakatuh. My name is Arifatul Adila. I will proceed with waste management. It is recommended that dosage calculations be carried out and double-checked one day before scheduled treatment to allow efficient preparation of injections and thus save time on the day of treatment. Double-checking is important to ensure that the correct activity of radium-223 is administered. Ideally, only start the preparation of radium-223 for injection once patient attendance is confirmed to avoid unnecessary radiation exposure to staff members and wasting a radium-223 dose. After preparing the radium-223 syringe, a sharp plastic line filled with saline should be attached to the syringe tip as a safety precaution. This reduces the contamination risk in case of spillage. All radioactive waste needs to be handled by properly trained staff and in accordance with local institutional regulations, but some countries may require additional special procedure for this disposal of radium-223. Clear and visible separation of radium-223 waste helps to minimize exposure of staff members. The short half-life of 223 radium allows for a decay in storage program for radium-223 dichloride therapy. The NRC allows license to hold byproduct material for decay in storage if that material has a physical half-life of 120 days or less. Radium-223 dichloride waste must be surveyed at the surface prior to its disposal. Documentation that is radioactive cannot be distinguished from background levels is necessary. In principle, for a radioactive material to reach background levels, it should decay for 10 half-lives. Thus, the waste generated from radium-223 dichloride procedure must be decayed for approximately 4 months prior to its disposal. The amount of radioactive waste that must be held for decay for each radium-223 dichloride procedure is minimal. A lockable cabinet within the hot laboratory may provide enough storage for the program. Accurate record keeping of each disposal is required per NRC regulations. Most low-level radioactive waste (LLW) is typically sent to land-based disposal immediately following its packaging for long-term management. This means that for the majority by volume of all waste types produced by nuclear technologies, a satisfactory disposal means has been developed and is being implemented around the world. For useful designated as high-level radioactive waste (HAW), the first step is storage to allow decay for radioactivity and heat, making handling much safer. Storage of used fuel may be in ponds or dry casks, either at reactor sites or centrally. Beyond storage, many options have been investigated which seek to provide publicly acceptable, safe, and environmentally sound solution to the final management of radioactive waste. The most widely favored solution is deep geological disposal. The focus is on how and where to construct such facilities. Used fuel that is not intended for direct disposal may be instead be reprocessed in order to recycle the uranium and plutonium it contains. Some separated liquid HAW arises during reprocessing. This is vitrified in glass and stored pending the final disposal. Intermediate level radioactive waste (ILW) that contains long-life radioisotope is also stored pending disposal in geological repository in USA. Defense-rated transuranic (TRU) waste, which has similar level of radioactivity to some ILW, is disposed of in
Waste Isolation Pilot Plant, or WIPP, Deep Geological Repository in New Mexico. A number of countries dispose of ILW containing short-lived radioisotope in near-surface disposal facilities as used for LLW disposal. Some countries are at the preliminary stages of their consideration of disposal for ILW and HLW, while others such as Finland and Sweden have made good progress. Finland's on-color repository is expected to start operating in 2023. It will be the first deep geological repository licensed for the disposal of used fuel from civil reactors.
And that's all from us. Thanks for watching.